groundbreaking new procedure using stem cells to create all-natural breast augmentation, and it's being done right here in the Valley. Take a look.
Hi, Erin. How are you doing?
Dr. Todd Malan is meeting with patient Erin Finch 1 year after she underwent a new trial breast enhancement procedure using stem cells.
Well, after having 4 kids, is kind of the area is no longer theirs.
Finch says she chose the procedure after her sister had done it. One of the biggest selling points, it's all natural.
I kind of wanted something more natural, something, you know, that's part of me. And you always say, oh, I wish I could take this and put it here, put it someplace different that you want it. And that's kind of what I was heading for, what I wanted.
That's the simple explanation, moving fat from one area of the body to another. Dr. Malan says it's actually much more complex.
And we take those fat cells, process them even further to separate out only the best fat cells. Then that fat is processed to extract the stem cells, and we take those activated stem cells, place them into another batch of fat that's going to go into the breast, and then it's all layered into the breast with needles.
While fat transfer is nothing new, Dr. Malan says it's the use of stem cells that make this procedure more successful in the long run.
By actually physically removing the stem cells from the fat, concentrating the stem cells in a new batch of fat, and then we have a supercharged batch of fat with stem cells that are actually active.
He's been performing the surgery since October 2009 when he was the first surgeon in the U.S. to try it out.
Are you close to where you wanted to at your goal right now?
His practice performs about 3 of the stem cell augmentation surgeries each week, and patients like Finch say they're pleased with the results.
My skin's tighter, you notice a total difference in, you know, my legs and everything, and I'm more volume, yeah. And so whenever I do gain weight, I'm supposed to gain weight in my breast area instead of in the areas which they.
And joining us now this morning to talk a little bit more about the procedure is Dr. Todd Malan with the Innovative Cosmetic Surgery Center in Scottsdale. Thank you for being here this morning.
Thank you.
We touched upon it obviously in the story, what exactly it is. How is this, I guess, the long run different than the most common way of breast augmentation right now, which is using silicone?
Well, with the silicone implant, we're trying just to increase the size of the breast. Okay. And in the way that we do it, we don't really get quite the natural appearance and the natural feel to the breast. The difference between a woman who's an A cup and a D cup is how much fat they have in their breast naturally. It's not how big their glands are. So what we're doing is we're just balancing that effect by actually taking fat from unwanted areas and adding it to the breast.
Now, when this was first done on Erin in 2009, yeah. Still experimental, and it's still at this point not FDA approved yet, but you guys are awaiting that.
Right, correct.
And tell me a little bit more about it. It's now being used in 17 centers across the states?
Yes, we were the first in the U.S. to start using the procedure with the stem cells. Mm-hmm. And now there's about 17 centers that are using it for the cosmetic applications. But we've also started to use the fat-derived stem cells for other applications in the U.S., such as treating patients with heart attacks, mm-hmm. and patients with liver failure and kidney failure. There's a lot of really exciting things going on with fat-derived stem cells.
Now, who qualifies to be a candidate for this?
Well, typically it's a person who's really looking for a modest increase in their breast size. Someone who's an A cup who wants to be a D cup really needs to look at implants as their preferred option.
Because you're not going to get that same kind of enhancement through the stem cells.
No, but we can really easily get a 1 cup size change, and going from a 1 to 2 cup size change is on most patients very doable.
How invasive is it? What type of recovery is there afterwards?
It's very minimally invasive. It's not the old-fashioned liposuction that you see. It's a device that's designed to really remove the fat very gently, so it's a living fat. Mm-hmm. And then the fat and the stem cells are injected through syringes into the breast. So there's no cutting. It's all done with needles and syringes.
And you guys are already doing this several times a week here in the Valley alone at your practice. When do you anticipate FDA approval in the long run?
That's a difficult question to answer, but we're hoping 2011 will be the year, but it may be early 2012.
It's a long process, I know, to get to FDA approval.
Yes.
Usually years is what it takes. And I know since it's new, it's hard to say if there's been any kind of side effects, but what are the side effects associated with this so far that you've
Well,
seen?
thankfully, we have the experience of the folks in Japan and in Europe who've been doing this for many years, and they have not seen any bad side effects from the procedure. In fact, as the time goes on, there's great side effects from the procedure. Because these stem cells activate the fat, the breasts become the new primary storage center. So we're seeing that as our patients gain weight, the new storage site is their breasts, so their breasts can actually increase over time. And the stem cells also help to rejuvenate the skin, which gives that lifted appearance, makes the skin healthier, and it's really got some neat effects.
Now, can you guarantee that the weight gain won't happen anywhere else except for that spot?
No, absolutely no guarantees, but we are seeing that effect tends to hold true with patients.
Very interesting, and who knew it was happening right here in the Valley for the
Yes.
first time. Dr. Todd Malan, thank you so much for joining us and shedding some light on that. I think it's very interesting. A lot of people definitely interested in learning more about it. If you would like to learn more about the Innovative Surgery Center, it's all on our website at azfamily.com. Thanks for joining us.